Hello and welcome. Let's talk about general anesthetic agents. So, what is pre-anesthetic medication? Drugs which is given before surgery to provide uncomplicated anesthetic and operative procedure by improving the rapidity and smoothness of the induction, reducing anxiety, providing analgesia and amnesia, and reducing salivation, bradycardia and other side effects of anesthesia. This is known as pre-anesthetic medication. The aim is to reduce anxiety, to provide amnesia, to produce analgesia, and to produce bronchial and salivary secretion. Now, drugs used. These include benzodiazepines as anxiolytic, sedative, and for amnesia purposes, and barbiturates for sedative and less nausea and vomiting production, and opioids for anxiolytic, analgesia, and sedation. Phenothiazine derivatives are used with opioids to potentiate the analgesic effects without side effects. Anticholinergic drugs are used to decrease salivation and to decrease bronchial and salivary secretion. Metoclopramide is used to hasten gastric emptying and increase the tone of the lower esophageal sphincter. It is also used as antiemetic. Antacid or H2 blocker or proton pump inhibitors are also used, and antihistamine is used to prevent allergic reaction. Now, what is general anesthesia? It may be defined as a condition of the temporary and reversible disintegration of cerebral function which allows surgical operation. Now, state of general anesthesia. There is analgesia, amnesia, loss of consciousness, inhibition of sensory and autonomic reflexes, skeletal muscle relaxation, and hemodynamic stability. Now, what is the criteria of an ideal anesthetic agent? There should be smooth and rapid induction, rapid recovery of cognitive function, produces analgesia, produces amnesia, loss of consciousness, and inhibition of the sensory and autonomic reflexes, relaxation of the skeletal muscle, maintenance of the hemodynamic stability, wide margin of safety, and devoid of adverse effects. So no single drug is available for this case, and the use in combination known as balanced anesthesia. Now, what is balanced anesthesia? It is a combination of various anesthetic agents to take advantages of each drug's beneficial effects while minimizing their adverse effects. It is used now in common practice. Now, components of the balanced anesthesia includes induction by IV anesthetic agents like thiopentol sodium propofol intermediate, maintenance by inhalation gas like nitric oxide and halothane, and oxygen is used with inhalation anesthetics to prevent tissue hypoxia, and opioid analgesic is used for analgesia, and muscle relaxants like succinylcholine or other curiariform drugs to provide muscle paralysis adequate for surgical access. Now, stages of anesthesia. It is observed mainly by diethyl ether and divided into 4 stages of the increased rate of the CNS depression, and the signs to be examined include pupil reflexes, respiration, ocular movement, and muscle tone. Now, stage 1 is the stage of analgesia, where there is analgesia and later amnesia. Stage 2 is the stage of excitement, where the patient becomes delirious, excited but amnestic. Stage 3 is the stage of the surgical anesthesia. With plane 1, there is a respiration is full, regular, autonomic, equally abdominothoracic. In plane 2, the respiration is regular but less exclusive. In plane 3, the respiration is more abdominal. In plane 4, the respiration is less abdominal. In stage 4, there is the stage of medullary paralysis, where the spontaneous respiration ceases, pupil is widely dilated. Now, routes of administration of general anesthesia. It may be intravenous or inhalation. Oxygen in anesthesia. Oxygen is also always used with inhalation agents to prevent hypoxia, and the concentration is at least 25 to 30%. Now, patients factor in selection of the anesthesia. It depends upon the nature of the surgical and diagnostic procedure, patient's physiologic, pathologic, and pharmacologic state. Now, the status of the patient includes age, pregnancy condition, liver and kidney condition, respiratory system condition, CVS diseases, and nervous system conditions. And concomitant use of other drugs includes pre-anesthetic agents, alcohol, and other CP450 enzyme inducers, and drugs that inhibit P450 enzyme. Now, phases of anesthesia. It includes induction, which is the period from the administration of anesthetics to the development of the effective surgical anesthesia in patients. Drug induction is essential to avoid stage 2, and the drugs used include thiopentane sodium and mainly IV agents. Now, co-administered drugs are the muscle relaxants, hypnotics, and opioid analgesics. Now, maintenance is the period during which the patient is surgically anesthetized. The drugs used are volatile anesthetics, nitric oxide, halothane, and oxygen. Co-administered drug is opioid for analgesia, usually fentanyl. Now, recovery is the time from discontinuation of the administration of the anesthetics until consciousness and protective physiologic reflexes are regained. Recovery is the reverse of the induction. The patients are observed for delayed toxic reactions. Now, classification of the general anesthetic agents. It may be inhaled or IV. Inhaled includes gas like nitric oxide, ether, chloroform, and volatile liquid like halothane, influorine, isoflurane, and others. The IV anesthetic agents may be ultra-short acting like thiopentane sodium, methotrexate, or benzodiazepines like diazepam and midazolam, or opioid analgesics like morphine and fentanyl, and others include propofol, ketamine, and etomidate. Now, mechanism of action. The main target organ is thalamus, cortex, and hippocampus. There is direct activation of the GABA receptor and the chloride channel, which is a major mediator of the inhibitory synaptic transmission. This is done by inhaled anesthetics, barbiturates, benzodiazepines, etomidate, and propofol. It may antagonize the action of the excitatory neurotransmitter glutamic acid on the N-methyl-D aspartate receptor by ketamine or nitrous oxide drugs. It decreases the duration of the opening of the nicotinic receptor activated cation channels, so decreases the excitatory effects of the acetylcholine at cholinergic synapses by most inhaled anesthetics. There is activation of the potassium channel leading to hyperpolarization of the membrane. There is activation of the glycine receptor. Those were the mechanism of action of general anesthetics. Now, inhalational anesthetics. These are the mainstay of anesthesia, and for maintenance of the anesthesia, these are mainly used. Halothane is a prototype, and oxygen is always used to prevent tissue hypoxia. These are non-flammable, non-explosive, and increase brain perfusion by decreasing cerebrovascular resistance. This causes bronchodilation. Now, assessment of the inhalation anesthetic agent or measurement of the potency or drug response characteristics is done by MAC, which means minimum alveolar anesthetic concentration. Minimum alveolar anesthetic concentration is a measure of the anesthetic potency defined as the minimal alveolar anesthetic concentration at which 50% of the patient is immobile when exposed to surgical stimulus. So it is used to express the relative potency of the gaseous anesthetic. So if MAC is increased, then potency also decrease, and if decreased MAC, potency is increased. It is the median effective dose of the anesthetic. If it is more lipid soluble, it lowers the concentration of the anesthetic drugs needed to produce anesthesia, lowers MAC, and high potency may be seen. Now, pharmacokinetics of general anesthesia. The depth of the anesthesia and rate of the induction depend upon many pharmacokinetic factors that influence brain uptake and tissue distribution of anesthetic agents. Now, concentration of the anesthetic drugs in brain includes lungs, blood, brain, and other compartments. Now, solubility in blood is the main factor. Increased blood solubility causes reduction in the induction and recovery, and the vice versa. Halothane is best in this case. Now, fat solubility determines the potency of anesthetics and kinetics of its distribution in the body. So, increased lipid solubility means delayed recovery from the effect of the anesthesia. Partial pressure of the anesthetic gases. Now, partial pressure of the anesthetic agent is directly proportional to its fractional concentration in the mixture. Partial pressure is directly proportional to its concentration but inversely proportional to its solubility in that tissue. Now, alveolar ventilation. Increased ventilation leads to faster the process of equilibration. Cardiac output produces complex effect. Pulmonary blood flow, arteriovenous concentration gradient, and anesthetic concentration in the inspired air. Now, metabolism. Clearance of the inhaled anesthetic via the lungs is the major route of elimination. It can generate hepatic toxic metabolite. Methoxyfluorine is released fluoride ion causes nephrotoxicity, so not used. Halothane can cause halothane hepatitis, and isoflurane disflurane is least metabolized. Now, elimination is by lungs into the inspired air, expired air, or metabolized in the liver and other tissue by enzymes. Now, pharmacological effects. In cardiovascular system, the blood pressure, decrease in halothane and influrin, which decreases cardiac output, isoflurane and isoflurane, which decreases peripheral vascular resistance, and increase in sevoflurane and nitric oxide. Heart rate is decrease in halothane, increase in desflurane, and no change in case of the enflurane and sevoflurane. Myocardial depression occurs due to increased right atrial pressure. All anesthetic agents can cause myocardial depression. Diffusion hypoxia may be seen, and sensitization of the myocardium to catecholamine is more in halothane and less in influrane. Now, respiratory system. Tidal volume decreased all except nitric oxide, respiratory decreased all except nitric oxide, respiratory depression all more in isoflurane and influrane. Partial pressure of the carbon dioxide is increased in all cases. Depression of the mucociliary function in the airway causing atelectasis and respiratory infection by all, or bronchodilation by all. Airway irritation is rare. Now, in case of brain, metabolic rate is decreased, cerebral vascular resistance is decreased, cerebral blood flow is increased, EEG is increasing in the seizure activity. In kidney, there is decreased GFR, renal plasma flow, and increased renal vascular resistance and impairment of the autoregulation of renal flow caused by all kind of general anesthetic agents. In liver, hepatic blood flow is decreased. In uterine smooth muscle, there is a relaxation because of the hydrogenated hydrocarbon anesthetics. Least effect is seen by nitric oxide. Now, adverse effects. In cardiac effects includes bradycardia, hypotension, cardiac arrhythmia, myocardium sensitization to action of the catecholamines, reduction on the hepatic and renal blood flow, hepatotoxicity, nephrotoxicity, malignant hyperthermia, mutagenicity, carcinogenicity, effects on reproductive organs leading to risk of abortion, hematotoxicity leading to megablastic anemia. Now, nitrous oxide or nitric oxide. It is a laughing gas and its MAC is 100%. Advantages includes rapid induction, rapid recovery, good analgesic properties, safe, non-inflammable, non-irritating, does not depress respiration and not increase the cerebral blood flow. Least hepatotoxic, devoid of any serious side effects, can be used in labor to relieve pain, also used in dentistry. Disadvantages includes less potent, cannot be used alone, should be given with other anesthetics. At least 20% oxygen is needed and no muscle relaxant property. During recovery may produce transient hypoxemia and risk of the bone marrow depression with prolonged use. Now, halothane. It is widely used agents and the advantages includes it is highly potent, pleasant to breathe, non-inflammable, non-irritating, good skeletal muscle relaxant properties, excellent hypnotic property and more bronchodilation and lowers BP. Disadvantages includes hypotensive, no analgesic properties, sensitizes myocardium to noradrenaline, hangover may be seen, risk of liver damage, malignant hyperthermia, depresses myocardium and may cause dysrhythmia. Influrane. It is halogenated and advantages are highly potent, rapid induction and recovery, good analgesia, muscle relaxation and hypnosis. Sensitization to myocardium is less and less risk of toxicity and metabolism. Disadvantages includes more respiratory depression, more CVS depression, risk of epilepsy like seizure, malignant hyperthermia and less production of the fluoride ion. Isoflurane. It is similar to influrane and the advantage is that faster induction and recovery and high potency, stability of the cardiac output, good analgesic and sedative hypnotic effects, does not sensitize heart to catecholamine, less risk of toxicity, good muscle relaxation, does not increase intracranial pressure. Disadvantages includes unpleasant, pungent smell, bronchial irritation and possible risk of coronary ischemia. Desflurane. Advantages are the rapid induction, rapid recovery, popular anesthetic for outpatient surgery, metabolism is less and decreases risk of toxicity. Disadvantages includes low volatility, irritant to airway and can cause laryngospasm, coughing and excessive secretions. Sevoflurane. It is similar to isoflurane and influrane and advantages include faster onset of action, faster recovery, no respiratory irritation, suitable for induction in children, so replaces halothane. Low blood gas solubility, so rapidly taken up and excreted, very pleasant to breathe. Disadvantages includes metabolized by liver, release fluoride ions, so causes nephrotoxicity and malignant hyperthermia, which may be genetical. Thiopental sodium. It is an ultra short-acting barbiturate and the advantages are potent anesthetic, rapid induction, rapid recovery, so very short duration of action, highly soluble and minor effect on CVS system. Disadvantages include narrow therapeutic index, narrow safety margin, no analgesic effect, potent respiratory depression effects, produce transient apnea, laryngospasm, and cough, can exacerbate acute intermittent porphyria, cannot be given alone and should be used in conjunction with other anesthetics for maintenance. Less metabolism, so may cause increased action due to repetitive dose. Risk of severe vasospasm if accidentally injected intraarterial. Decreased force of contraction and dilates peripheral vessels, so cannot be used in shock. Now, propofol. Advantages are it is the most popular IV anesthetic agent and first choice for induction. Onset of action is very rapid and smooth. Recovery is very fast. Both induction and maintenance of the anesthesia, it can be used. Patients feels better in the immediate post-operative phase. Rapidly metabolized and useful for day case surgery. Decreases BP without depressing myocardium. There is no post-anesthetic nausea or vomiting and there is less CNS depression. It is very useful anesthetic in resection of spinal tumor. Disadvantages includes poor analgesic, excitatory phenomena may be seen, respiratory and CVS depressant effect may be seen, and hypotension may be seen. Now, intermediate. Advantages are used for induction, minimal CVS depression, minimum respiratory depression, less rapid recovery, and redistribution from brain to highly perfused area. Disadvantages includes no analgesic effect, rapid distribution may cause post-operative nausea and vomiting, involuntary muscle movement during induction, and possible risks of adrenocortical suppression can cause hypotension, electrolyte imbalance, and oliguria. Now, opioid analgesics, these are alfentanil, sulfentanil, morphine, and remifentanil. These have good analgesic effect and frequently used with other analgesics. They can produce neuroleptic anesthesia with fentanyl and droperidol causes anesthesia along with analgesia and amnesia. Ketamine. It is a potent anesthesia and short-acting and non-barbiturate. It is an analog of phencyclidine. It produces dissociative anesthetic states which is characterized by sedation, analgesia, and amnesia with or without loss of consciousness. So patient is unconscious but appears to be awake and does not feel pain. The lipid soluble and distribution to other organs and tissues is seen. Mechanism of action of ketamine is that it may involve blocking of the NMDA receptor, so blocks glutamic acid. Advantages. Only IV anesthetic agent which poses both analgesic dose related CVS stimulation. So increase in blood pressure, cardiac output, heart rate by stimulating CVS. There is markedly increased cerebral blood flow, oxygen consumption, and intracranial pressure. Ketamine is very useful for poor risk geriatric patient and high risk patients in cardiogenic or septic shock. It is also used for short procedure in outpatient anesthesia in combination with propofol and children undergoing painful procedures, dressing changes for burns. It is used in patients with either hypovolemia or cardiogenic shock as well as in patients with asthma. Now, disadvantages of ketamine. The onset is relatively slow, about 2 to 5 minutes, and there is high incidence of post-operative psychic phenomenon. Post-operative hallucinations like nightmares may be seen. End of the topic.